one of the things that Wellstar invested in, right, up front was we're going to get the space we need to put in the facilities that we need. Had a building there that was not fully occupied, a medical office building, and they came in with the check, right, and the checkbook, which was awesome. We had the talent, obviously, with the two of you and others, but talk to us about some of the equipment and some of the specialties, because one of the things we talked about before going live on the show here is the cyber knife, and that comes up all the time. Is we let people will say, "What's a cyber knife? What is that?"
And that, I'm going to let him speak to that, but that was actually the one missing piece of our cancer program before Wellstar invested with North Fulton is we had to partner with different groups for our radiation services, but now it's on campus. And so we have 100% of what patients need. And Mark
That
can talk about that more.
Yeah.
One stop.
Right. When I went there, we didn't have, as Dr. Pearson said, we didn't have radiation oncology on campus. And to get radiation oncology, any facility, we have to apply for a certificate of need. So we had to show there was need. And what I was doing for about 3-4 years is showing that there would be a need for radiation oncology services at North Fulton. So we're seeing the patients who would need radiation oncology, and basically using that data to promote to the state that we can put should we have a radiation center there. Once the state said that we could get a radiation center, Wellstar once again brought their checkbook, and we wanted to get a really up-to-date modern machine called the cyber knife.
Welcome back to Brew Talks. I'm Steve Stroud, President and CEO of Roswell, Inc. We're your economic development organization here in the city of Roswell.
And I'm Ashley Allen, VP of Operations at Roswell, Inc. First, I want to thank our sponsor, Wellstar North Fulton Hospital. And we're actually interviewing two of the doctors today from Wellstar, Dr. McLaughlin and Dr. Pearson. Thank you guys for being on with us today.
Thank you.
Thank you.
It's awesome. This is part of our outreach, right, and partnership with Wellstar is being able to feature the hospital and the doctors that make up the hospital, right? So, and there's some good stories to be told. So we're excited to hear a little bit about what you each do, and then go into some dialogue about what the cancer unit, for example, is doing at North Fulton.
So yeah, I've been actually privileged enough to be working at North Fulton since 2010. So before Wellstar, but it's been amazing to see how the hospital and the cancer program itself has really grown. I started off as the breast director there back in 2010 and very intimately associated with the cancer program. And then we joined Wellstar, and that was just a huge injection of energy and support. And we've really just blossomed in so many ways and so many different cancer types and services that we offer to all of our patients in this community.
Sure.
So I started at Wellstar in 2006, and it was at Kennestone.
Okay.
Majority of my career was at Kennestone. When Wellstar purchased North Fulton, and we aligned, I decided to go to North Fulton and basically help out in starting the cancer program and kind of correlate with Wellstar's values and vision.
Which is awesome. And obviously, it's just grown. So one of the things that Wellstar invested in, right, up front was we're going to get the space we need to put in the facilities that we need. Had a building there that was not fully occupied, a medical office building, and they came in with the check, right, and the checkbook, which was awesome. We had the talent, obviously, with the two of you and others, but talk to us about some of the equipment and some of the specialties, because one of the things we talked about before going live on the show here is the cyber knife, and that comes up all the time. Is we let people will say, "What's a cyber knife? What is that?"
And that, I'm going to let him speak to that, but that was actually the one missing piece of our cancer program before Wellstar invested with North Fulton is we had to partner with different groups for our radiation services, but now it's on campus. And so we have 100% of what patients need. And Mark can talk about that more.
Yeah.
One stop.
Right. When I went there, we didn't have, as Dr. Pearson said, we didn't have radiation oncology on campus. And to get radiation oncology, any facility, we have to apply for a certificate of need. So we had to show there was need. And what I was doing for about 3-4 years is showing that there would be a need for radiation oncology services at North Fulton. So we're seeing the patients who would need radiation oncology, and basically using that data to promote to the state that we can put should we have a radiation center there. Once the state said that we could get a radiation center, Wellstar once again brought their checkbook, and we wanted to get a really up-to-date modern machine called the CyberKnife. What the CyberKnife is a way to deliver radiation. It has a lot of nuances that are a little bit different than what we use for standard conventional radiation. The first thing is we can use what's called radiosurgery. And radiosurgery is where you're delivering a very high dose of radiation to a very small target. The benefit of that is you're getting a much greater dose of the tumor volume.
Gotcha.
The second benefit is it's minimizing the radiation dose to normal structures. So the side effects, the impact of radiation on normal tissues is much less. The third benefit is a lot of times you can deliver this radiation much quicker than our standard conventional rate, which is 4, 6, 7 weeks of daily radiation, which is very time consuming for patients.
Yeah.
This radiation can be given in 1 to 5 fractions, so it's a lot quicker for patients to accomplish and complete their radiation.
Wow.
The fourth benefit is what we call image guidance. When we treat radiation, conventional radiation, many times we have to take into account movement of the patient or movement of the tumor. For example, if a patient has breast cancer, she'll be breathing during the treatment. They can't stop breathing, so they're breathing during the treatment. So their tumor volume or target volume constantly changing. So with the CyberKnife, we can actually track and move the machine in real time. So as the patient moves or the patient breathes, the machine moves in real time. Where a conventional machine, we don't have that opportunity, so we have to treat a larger volume or larger margin to accompany that. And then one of the other benefits is called the pencil beam technology. Pencil beam is when we use a very small beam of radiation. Instead of larger beams that may be 10 by 10 centimeters, pencil beam may be a millimeter or 2 in size. And you use multiple beams that are small. They call it pencil beams because they're so small, but the benefit of that is it allows us to treat a lot less of normal tissues. That collateral damage, collateral exposure is just much less.
Wow.
So with all that, we've been able to really revamp on how we treat patients. For example, with breast cancer patients, a lot of times we'll just treat these patients in 5 fractions, which is a week, as opposed to treating them for 4 to 6 weeks. We can also treat them so when they move, we're actually moving in relationship to their movement. And what that does is it allows us to minimize our radiation dose to things like lung and heart, which are extremely important in these patients. Brain tumor patients, we can expose them to a lot less radiation and minimize the dose to normal structures. And so we're using that in really our whole gamut of what we do. Prostate cancer patients, instead of 6 to 8 weeks of radiation, 5 days every other day, which is much easier for these patients.
Absolutely.
So this is a way that we can maximize the benefit of radiation and minimize their exposure to normal tissues and treatment time they commit to coming to see us.
Yeah.
Well, Wellstar's always had a strong cancer program. It's just now, though, that you've got a strong, full service, I'll call it, cancer program at North Fulton. And I think one of the key things, and maybe you can comment on it, is that prior to this commitment by Wellstar for the cancer unit, you really had to travel. You could get the consultation, you could see the doctor, but to get the services you're talking about, you had to travel outside of Roswell or North Fulton to really get a cyber or even the radiation, because I don't think the radiation was available at the hospital. Right.
Yeah, that was
there
one
were
thing I was
other
gonna ask
providers,
is-
but not
Yeah,
at the
it,
hospital.
How
it,
far
it was
were
not. It
people
was
going?
not too terribly far, but it
but
was
it wasn't.
certainly. It wasn't a continuity of care within the providers and the hospital system itself.
Yeah, and I think one of the things that you know my story. I lost my wife from triple negative back in 2013, and we were at Emory. And this is not about Emory, but had we had that full round service here, we would have been a lot easier for the family. Is what I always say. It's about quality of life. It would have been much easier for my wife at the time, right? It would have definitely had an impact to be 4 miles from the house instead of a 50 to an hour, 10-minute, depending on the time of the day. And that's not Emory's fault, right? It's just the way it fell. But having that is such an asset to our community long term. I think that that's just one of those key things that people forget. Like, we got all these great shiny tools, but it's the full you all have the full piece there now, which just wasn't there. And again, it's just a bonus. So.
Well, I know you guys, really care about the experience for the entire family and looking at, how can you support the patient fully. So kind of walking it back a little bit, what does that process kind of look like at the point of someone's been diagnosed? What are the next steps and how do they kind of work through that?
So for many of our cancer sites, we are able, and I'm so excited that we're able to have stat clinics, not only for breast. Breast stat clinic was our first one, but we now have head and neck, neuro, cancer, prostate, and lung. And so those patients, if they're found to have something abnormal and or a new cancer, they're able to come to a one-stop shop clinic where they meet with all of their providers, all of the people that are going to be part of their cancer team. So surgeon, radiation oncologist, medical oncologist, potentially plastic surgery, genetics, if that's appropriate. And we're also presenting those patients at our multidisciplinary cancer conference at the same time. So our radiologists are there, our pathologists are there, our dietitian is there. And so we really have the opportunity to create a plan for these patients. And then those patients and their families get to be seen all at once. So they're not taking multiple trips to the doctor back and forth and trying to get piecemeal treatment plan together. This is a cohesive treatment plan that's given at one time. And it does change as more information comes in, but it's a much more efficient process, and patients, I think, really appreciate that efficient nature, but it also lets them know that we're all communicating about every aspect of their care.
And that's been one of the bonuses of having the hospital in our community and then to see it grow. To me, there's nothing better than being able to see one of my daughters, right, that participates in your program, that is able to check in, make sure that everything's there. My chart, love the My Chart for us. Ashley's a big fan because of Kenneth Stone.
Got to make it easy.
Got to make it easy. And it is. It really is. It kind of builds that whole piece together because you feel like, and it always helps when you know the people, right? Dr. Scott, I always love to give him a hard time. But at the end of the day, I think those are the pieces that have been added that have just elevated the hospital in this community tremendously. Just all good pieces.
Yeah, no, I'm in the evolution of the cancer program. I'm just, again, so proud of how we've brought this to the Roswell, Alpharetta, sort of North Fulton community in a way that patients don't have to feel, or they shouldn't have to feel like they have to leave to get the expert care that they need and have access to all the pieces of the treatment and having to drive an hour and a half or something like that. They really can get all of that right here.
And you said it too, and I said a little bit about it earlier, but there's that sense of community, right? And that sense of security of being in your own community. It's such a traumatic thing, right, for so many people. You hear the C word, and people just it just has so many effects on people. But having that here local, where you can go and it's where you go to the doctor anyway. It's where you've seen your relatives in the hospital. There's a sense of
comfort because you're somewhere familiar.
It's a security piece, right? Which you all have been, and the consistency of having both of you running the program is really important. What are some of the other items that are on the future or have come into the cancer program, equipment-wise, or programs that you see, or what's on the horizon for?
Well, I think one of the secret sauces that Wellstar has is our nurse navigators. Nurse navigators, Wellstar has made a commitment to hire and basically have nurse navigators in all our subspecialties. And their job is really to walk the patient through that journey. And not only the patient, actually the family too. When you're diagnosed with cancer, it's very difficult for the patient, but sometimes it's even more difficulty on the spouse and family.
Sure.
It could be insurance reasons, travel logistics, all that stuff. And what Wellstar's done is hire these nurse navigators that will explain and help basically take that patient through their journey and also help with appointments, help with discussion of future thing, whatever they might have or questions they might have after they visit the physicians or caretakers. And Wellstar's done a wonderful job with that and made a situation that's extremely stressful much less stressful because he's navigating.
Taking it out. Yeah, that's awesome.
They're
That's
a
awesome.
huge resource for our patients in terms of connecting them with community resources, financial resources, and just other support groups and other patients, or just helping navigate those appointments and making sure that everything makes sense. They're there for the patients who have their questions 2, 3, the same, over and over. They give that patient an opportunity to ask the question again, because sometimes patients feel like they don't want to bother their physician. They don't want to look, that way. But the navigators are just so approachable and so warm that they are invaluable to the cancer patient's whole journey through their whole process and their family.
Well, and we're human, right? So it's a lot of times we only hear what we are, and you could have two people in the same. We laugh, right? This is my work wife. My home wife is Amy, and I've got Ashley, and so periodically I'll say Amy, and I'll say Ashley to Amy. But we hear things differently, and so having somebody that you could go, hey, let's call and let's hear that again from just because.
Well, when you're stressed, right? It's so easy to just get overwhelmed, and you're like, what did they tell me at that doctor's appointment? Or did you pick up on what I was supposed to do for da-da-da? And then the person that was with him was like, no, I was caught on, this detail or that. And so to have a lifeline to call to say, help me out here.
And we do encourage patients to bring their family, because it's nearly impossible when you're in the hot seat to remember anything. Yeah. But even then, the families are under stress. They're going through their own journey with this as well. And so for me, and I think the whole cancer program, we try to give as many points of contact and points of information for patients so that they never feel like they're out there on their own.
That's important.
Yeah.
You just added some new beds, right? Some very critical beds. How does that affect your program?
So happily, my breast patients don't very often stay in the hospital.
That's good.
So most of what we do is outpatient. Even with larger surgeries and reconstructions, most of the time those patients can go home the same day.
Nice.
But what it does do for our more complicated, like colorectal patients or prostate patients, it allows us to make sure that we have the space and the resources for them to get the care that they need while they're recovering, and it not impact all the other things that we do at North Fulton, like trauma and neurointerventional and cardiac interventional, and
Opens that gateway up.
high risk L&D, all those other things that we do. It allows us to make sure that we have the resources for our post-surgical patients,
Which makes a big difference when it's critical and things happen, right? I mean, that's just that's awesome. We were very blessed to be up there and cut that ribbon and open that unit up, and just to see what that has added. Again, that's one of those bonuses that the Wellstar team has brought to North Fulton. It's just phenomenal. People don't realize how important that really is.
Yeah, the two subspecialties that probably impact the most, we have two otolaryngologists, ENT surgeons, that are specially trained not only to do surgery for head and neck cancer, but do plastic surgery.
Oh, wow.
So they're really some of the few people in the whole U.S. to do both of those. And they're both at Wellstar North Fulton. So if you're diagnosed with head and neck cancer in the Wellstar system or even beyond, whether you're in Douglasville, Paulding, or whatever, you're then having your surgery at North Fulton. And if you need post-op radiation or post-op chemotherapy, you're getting them back in Douglasville or Paulding, where their hometown is. But what that's done for North Fulton is that you have these two experts, literally world's experts, and you have an ICU that just caters to them. So the nurses know what to look for that. And they're basically treating patients as they would be treated at a tertiary care center, but it's at North Fulton. They're treating not just the North Fulton patients, but patients who live in Paulding, Hiram.
Coming from all over.
Yeah, all over.
In town.
Right, and coming here, have their surgery, then going back to have their post-op care. So that's been a beautiful thing. And actually neurosurgery, too, has expanded their footprint to do more and more, not only just taking, brain tumors, but they're also doing a lot of vascular procedures, neurovascular procedures, that has helped out with this expansion of their intensive care unit.
That's pretty amazing.
Wow. So they're doing some very high-tech things. It's not just what you'd expect in a community hospital.
Yeah, we're not just touching our community anymore. We're touching
But
the
we're
metro
becoming
area.
a destination for
destination
expert care.
Which is great. That's what we want.
Right. And so, as a community hospital, we want to do the basic things excellent.
Sure.
But what we're also doing is we're expanding to do some of the things you would see in a tertiary care hospital, clinical research. Our clinical partners from Medical Oncology, Northwest Georgia Oncology, has a very, very strong research program. So if you come to North Fulton, you have access to research trials.
Amazing.
We actually have basically we work with Mayo Clinic very closely, and we have research trials in radiation oncology that are available. So if you come to North Fulton for your radiation, you have access to research trials.
Wow.
So those are things that most community hospitals don't have.
No.
That the Wellstar system does have. We're also expanding in terms of radiation oncology. A thing called radiopharmaceuticals, which is very, very novel, and really you see it in a lot of academic centers. It's basically using radiation and attaching them to antibodies or particles that are attracted to cancer cells. And we inject these particles into the patient, and the particles go to where the cancer cells reside.
Oh, wow.
Now, we're doing that for prostate cancer, metastatic prostate cancer now, but we're going to expand to other types of cancers with time.
Makes sense.
But what we're doing with the benefit of that is
crazy.
the radiation is actually going to where the cancer cells are, and hopefully minimizing the exposure to normal tissues. So it's a little bit easier. It's usually an injection every 6 weeks that the patient will get, and as opposed to having to come in weeks and weeks for daily radiation. So there are new things that we're developing on the North Fulton campus that a lot of times you wouldn't see in a standard community hospital, but Wellstar has the forethought to basically help our patient population that this is available.
That's wonderful.
Yeah. So with the cancer center being a comprehensive care now, and then with some of these kind of newer avenues that patients can take, are there any cases that just really stand out to you guys as just amazing examples of what is possible now that North Fulton can offer this level of care?
I think there's a lot of cases, but it's really the conversation and continuity of care that allows us to do that. Before we had all this, like Dr. Pearson was saying, people were getting their radiation at one hospital and their medical oncology at another.
Yep.
Everything's under one roof. And the benefit of that is the communication with the physicians, and the physicians communicating as one unit with the patients and their family.
Yeah.
So you just get a lot better care that way. And basically by putting multiple heads together to get the best opportunities to do well.
That's amazing. Yeah. Well, what you're doing is a commitment, right? And it's a commitment by Wellstar, but a commitment by the two of you. So we thank you for your commitment to our community, because it only makes it safer for our families and our business community to prosper, right? And we all want a great quality of life, and you can't have that without healthcare. And I think I might be getting a little grayer up here, and you start to realize how important that is to have those relationships.
Yeah,
So thank you.
You're welcome. And
Yes.
again, it's just, over the last 15 years, I'm just amazed how this whole community has grown, but I'm glad that the hospital has grown with it,
has.
and is really bringing things, close to home.
It's a key element. It's a key element. So we always say it's a great day to do business in Roswell, but I'm going to say this. It's a great day to be in a healthy climate in Roswell, and thanks to Wellstar. Dr. Laura, Dr. Mark, thank you both for being on the show today. Thank you for all you do, and keep doing it, because we want to stay healthy, right? We're not done yet. Cheers.
Thank you.
Thank you.
Cheers.